Welcome back to It's Personal. It's Personal is brought to you by Gunderson Health System. I'm Christopher. Skin cancer, something that we're all concerned about, we all have to deal with. And many people know people who've had to have something removed from their face, from their hands, etc. We want to talk with Dr. Stephen Webster, dermatologist at Gunderson Health System, about the prevalence of skin cancer. Thanks for joining us.
Glad to be here, Chris.
So skin cancer is unfortunately on the increase.
Skin cancer is on the increase, and skin cancer is the most common cancer that involves mankind. Each year in America, 3.5 million people will get skin cancer. That's 1 in 5 Americans will develop skin cancer, and there's more skin cancer than all the breast, lung, colon, prostate put together.
That's just an amazing number and a frightening statistic. And as I said, a lot of people worry about skin cancer. What should people worry about?
Well, people should worry about, first of all, not developing skin cancer.
Right.
And just like the pulmonologists talk about not smoking, because that causes lung cancer, ultraviolet light rays cause skin cancer. Mm-hmm. And we encourage people to protect themselves from the sun, to use sunscreen, to wear proper clothing, a long-sleeve shirt, a hat when you're outside, and being in the shade when it's possible, and remembering that the sun is most intense from 10 until about 3 or 4. So that's the time that you have to really be careful about protecting your skin from the ultraviolet light rays.
Well, let's talk a little bit about, we definitely want to talk about protection, but I want to talk about, if we can, what should people look for? People say, I'll be flat out honest with you. I've had something removed from my nose. I was concerned, talked to a dermatologist. He said, let's get rid of that. Is that common? Is that what we should be doing? How do you get screened, or what do you look for?
You should remember that skin cancer is the most common cancer there is, number one.
Right.
Number two, you should remember you don't need a laboratory test or an x-ray to diagnose skin cancer. You have to look at your skin. And we ask people, women are encouraged to do breast self-exam once a month, and if they find a new lump, they go in and have it checked. We ask people once a month to go over your skin from top to bottom, looking at places you don't always look at, bottom of the feet, and the groin, and so on, getting a mirror so you can look at the back, or having a significant other look at the back, and you're looking on the skin for anything that's new, anything that's changing, anything that isn't healing properly, anything that's sore. And when you're used to looking at your skin, you can be very sensitive to, gee, that's a new little brown spot there that I haven't had before.
Yeah. And then keeping an eye on it if you do see something, or when do you go in to get it looked at with your primary care provider, or when do you take it to the level of going to see a dermatologist like yourself? Basically,
I think you make sure someone looks at it and records it.
So taking a picture on your cell phone might be an idea.
Is an idea.
And say,
probably looking at someone directly is better.
Right.
And the sooner we can get the skin cancer off, the better it is. Mm-hmm. And so it is very important. And if they have a primary care doctor, yes, they can look at it. If it's something that's growing rapidly and bleeding or crusted or not healing, or a mole that's changing, encourage them to talk to a dermatologist.
What is a melanoma?
A melanoma is a malignant mole. It's a malignancy that develops in pigment cells. And melanoma is particularly important because the melanoma is the least common skin cancer we have. Only about 2 to 3% of the skin cancers we see are melanomas. But it is the most serious, in that over 80% of the mortality due to skin cancer is due to melanoma.
And that early detection
is so key.
And
the early detection is what makes the difference, getting it off while the getting's good.
All right. I want to talk to you a little bit about the prevalence of melanoma. We've talked about the prevalence of skin cancer already, but when is melanoma most likely to show up for women, and when is it most likely to show up for men? I think there's some statistics out on that.
Yes, there are. And I took my dermatology and my medical training in the late 50s. And at that time, we saw melanomas primarily in older people, particularly in older men. Now we are seeing it in younger people, and particularly now the melanoma is the second most common skin cancer seen in women 15 to 29 years of age.
15 to 29.
15 to 29 years of age, and that is entirely new, and it is specifically due to the tanning salons. The women are, as girls, going in and getting a tan because they think it looks beautiful. If the skin is tanned, the skin is damaged. But they are the ones that are going in, and we're trying to get this information out, and men don't have a tendency to go into the tanning salon. So we are seeing melanomas in younger women, whereas in men, like when I was in training in the 50s, we saw it primarily in older men in their 50s or 60s.
And now, for men, it is still showing up later in life due to the fact that they're not at the tanning salon, or they're not doing the fake bake, as it's called. We're talking with Dr. Stephen Webster, Gunderson Health System dermatologist. One of the things that, if you've ever seen Dr. Webster out at, say, Riverfest or at some event, he's always got a big hat on, right?
Right.
And it's not just a ball cap, it's a big hat to protect your skin.
It's a hat with a wide brim that protects the ears and so on. One of the worst times of my life was in spring a number of years ago. I did go out and work in the yard, and I didn't have a hat on. And I was the liturgist at our church the next day, and I got up to read the scriptures with a sunburn, and I got many comments from the congregation and for a week thereafter.
Sure. The dermatologist with a sunburn.
What you told me, Dr. Webster, you didn't do, so they were right.
So you're practicing what you preach.
I am.
No pun
definitely.
intended there with the church
Definitely.
reference. Talk a little bit, if you would, about sunscreen. And what you use personally is a natural product, from what I understand.
Okay, first of all, the simplest way is a broad-brimmed hat, which takes about half a second to clap on. If you're going to be out for a long period of time, long-sleeve shirts to protect that. The sunscreens, basically, we recommend a sunscreen with an SPF, sun protective factor, of at least 30. 30 or higher. When you get above 50 or 60, there's not a lot more protection, but at least 30, and it also should say broad spectrum. Broad spectrum means it protects against the entire ultraviolet light spectrum, and that's important. If it doesn't say broad spectrum, and if it's not an SPF 30 above, you're not getting the best to put on. The other thing I tell people is to get it in a form that you like the way it feels. My wife has very dry skin, and she likes more of a moisturizing base. I prefer more of a vanishing cream base. The sprays are fine as long as you spray it and make sure you spread it around properly. But it is important that you do spread it around and that you put it on 15 to 20 minutes before you go outside, and then reapply it every 2 to 3 hours.
Now, you use a zinc-based product personally?
The ones that have zinc oxide and titanium dioxide, those are natural blocking agents. And yes, those are in a lot of the things we use primarily. Now the chemicals, oxybenzones and things like that, are also effective. And so I like one that has many different products in it. But it should definitely say an SPF of at least 30.
I want to ask you about the ABCDEs of skin protection and skin cancer, and keeping an eye out for what it is that we need to be concerned about when it comes to the biggest organ in our body, our skin.
This is good. When you're looking at a pigmented lesion, you remember A, B, C, D, E. A is asymmetry. If one side isn't equal to the other, that's abnormal. If you look at the normal moles on your body, they're perfectly symmetrical. B is border. If it has an irregular border, that's abnormal. C is color. Not if it's dark or light, but if there's an irregularity in the color. Nothing consistent. A lot of the moles now will be darker in the middle and lighter at the edge, but they're perfectly symmetrical with the pigmentation. D is diameter. If it's bigger than 5 or 6 millimeters of the eraser on a pencil. And E Is it evolving? Is it growing? Is it changing? So the asymmetry, the irregular border, the variation in the color, the diameter, and the fact that it's growing, those are all signs of an unusual growth pattern. That is, and what a malignancy is, it's our normal cells that have lost their control, so they're growing out of control.
And again, early detection
and
is
again,
key.
picking it up. If you have any questions, you go in and talk to a provider about it.
All right. Dr. Stephen Webster, we really appreciate your time. Dr. Stephen Webster, a dermatologist at Gunderson Health System. We appreciate his insight into taking care of, again, that largest organ in our body, your skin.